Thank you for visiting Savernake Dental Practice. I'm Jonathan Taylor, Senior Partner, and I'd like to take you on a tour of the practice and introduce you to my colleagues.
This is a family-orientated practice. We tend to see people for long periods of time. We see parents, the children, and now I've been here long enough, I am seeing the children of the children.
Much of our work is general dentistry, but we do an awful lot of unusual dentistry when it's needed.
The facilities here are state-of-the-art. They comply to the absolute latest in guidelines in terms of cross-infection control, and there are probably very few practices with that sort of level of facilities.
We have 8 surgeries, 2 of which are dedicated hygienist rooms. One surgery is for our vocational training programme, and the girls are very pleased that we have a very large staff room.
It's just the whole facility here is much easier. The patients can park right outside the door, which they love. We've got a lift to get people with wheelchairs, buggies, or just if they're, had an injury or can't walk for some reason, it's easier to get them upstairs. Surgeries are nice and light and airy.
Having moved to this grand practice, I don't know really how to put it. I would say, without a shadow of doubt, it's the best practice I have ever been in. Everything is state-of-the-art and we're very proud of it.
We specialise in dental implants, ceramic restorations, we've got orthodontics, periodontal surgery, sedation, a whole range of treatments, and we carry out most of our own oral surgery.
We provide a lot of services. People don't tend to have to go elsewhere. Jonathan does his implants. We've got wonderful hygienists, so periodontal problems we can deal with in-house, which is great.
I like to think that we cater for everybody because we have a national health side and a private side. We are very keen to get children on board as soon as possible, and the old saying of teeth for life we really like to put into practice.
Dental hygiene is sometimes an underestimated part of dentistry, but it actually is the most important. If a patient is not cleaning and looking after their mouth well, no matter how good a fill-in, even an implant, a crown, anything, it is either going to fail or they lose the risk of losing their teeth sooner they should. What we do in this room is we look at the patient's mouth, see what obstacles they're up against, explain what disease they've got, explain what we need to do to solve it, and show them what they need to do at home to solve it. Because although we help them here, it's really what they do at home that's the most important.
I have to say that as far as my dentist is concerned, she's probably the best dentist I think I've ever been to.
Well, I've never ever had any problems. They're always very, very pleasant. Jonathan's always very good. He'll always do what I ask him to do.
I can't really speak highly enough of the practice and the people within it.